Hi, good morning Peterson. My name is Serena Shardik. I'm your invigilator for the OET speaking session on the 7th of April 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Peterson Brownfield.
And what is your candidate number, please?
My candidate number is 265982331.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Okay. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How do you handle a situation where your replacement does not arrive on time?
I will contact my replacement roughly an hour before my shift ends to ensure that they will arrive on time. If they communicate that there will be a delay or absence, I help them find a substitute to take their shift, or to inform the senior nurse or doctor when I cannot find a substitute. In either case, I make sure not to leave my post until my replacement arrives.
How would you handle a disagreement with a doctor?
Doctors may handle a lot more patients than nurses. Sometimes, it becomes difficult for them to keep track of medical records and patients' histories accurately. When there is a discrepancy between the doctor's instructions and a patient's medical records, I will discuss the issue in detail with the doctor to get it resolved before we take any further action. When we cannot resolve it, we take a mutual decision to escalate it to a supervisor.
Describe how you manage a busy workload.
Whenever there are too many tasks ahead of me in a shift, I sit with the other nurses to split all our tasks into smaller components and handle them one at a time. Usually, we devise a workflow where a single person handles similar tasks. This way, we increase speed and efficiency by working in groups and delegating tasks effectively.
How do you respond when people ask for your personal diagnosis outside a clinical setting?
I am often approached by friends and family about ailments and health issues that they may be experiencing. Although I may provide them with a speculative diagnosis, I always refer them to a doctor so that they can get it looked at professionally.
How well do you work with other nurses, doctors and staff?
During my clinical training in the emergency response room, I learned how important it is to communicate well with other nurses. For example, I make sure to consult with a senior nurse or doctor whenever I administer a new treatment or medicine to patients. Often, doctors know the medical history of their patients in detail, so I find it best to consult with them rather than go by the demands of the patient.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your OIT speaking role play. Don't worry if I stop you when the time is up.
Thank you for allowing me to assess your arm. From my examination, I can find that the area around the sting is red and swollen. Now, Serena, I would like to get a few details from you, for clarification.
Sure, you may please go ahead.
Thank you. Have you had a wasp sting before?
No, nurse, I never had a wasp sting before. Nurse, I am very much worried, because the inside of my arm is so red, and is also painful.
I acknowledge your words, Serena. Don't panic. We are here to help you. Well, explain to me in your own words, about the symptoms you are experiencing right now.
Actually, the area around the sting is a bit itchy. Beyond that, I don't have any other symptoms.
All right. Based on my examination, there's nothing to be alarmed about. I can reassure you that it is a large local sting reaction, and not a cause for concern. Don't worry about the symptoms. They are self-resolving, and will go away after about 1 week.
Is it?
Yes, it will. For your better understanding, I will give information about wasp sting. Normally, a person will undergo different levels of reactions. For example, you are experiencing redness, itchiness, pain and swelling. Some others may also feel the heat at the site of the sting, and potentially hives, if your body has a reaction to the sting. Moreover, allergic reactions in some cases are seen.
Okay.
However, in your condition, you are facing only minor symptoms, which will subside naturally. Serena, for cases like yours, the full reaction can usually be seen after 2 to 3 days. I hope you understand my words.
Nurse, I got it. But, I have heard that some people have really bad allergic reactions to stings. I am terrified about it.
Your concerns are quite reasonable. I also agree with your words. As I said earlier, in some cases there are chances of several allergic reactions. Since you haven't had any allergic reactions so far, there is no chance of it anymore. Allergic reactions vary from person to person. Don't panic, I can explain it to you in detail.
Yes, please.
The most severe allergic reactions to wasp stings are referred to as anaphylaxis. Anaphylaxis occurs when your body goes into shock, in response to wasp venom. Most people who go into shock after a wasp sting, do so very quickly. Yes, it will happen usually immediately. At the same time, it is very rare to happen.
Oh, really? And nurse, how you can be sure this won't happen to me?
Yes, Serena, your concern is quite natural. Since you haven't experienced any of the allergic reactions like that immediately after the sting, there is actually no room for tension. These reactions are in spontaneous response to the wasp venom. You won't be encountering such reactions anyway, as it is being a couple of days after the sting. Those reactions will be very severe, and not like what you are currently having. Thankfully, you ain't have come across such situations.
Yes, that's true. I was having only these minor symptoms. Now I understand, nurse.
All right. Well, Serena, may I know, have you taken any self-treatment?
No, nurse, I haven't done any self-treatment, because I wasn't sure what to do after the sting.
All right.
Nurse, I want to know what I can do to relieve the pain and itchiness.
Definitely, I am glad to explain it to you. For your case, prescribed medications are not needed. I will guide you in detail.
That is so kind of you, nurse.
It's my pleasure. Details of self-care to relieve your symptoms include, you can take over-the-counter painkillers for pain relief. Along with it, antihistamines can be used to reduce itching. Apply the creams for itching over the affected area.
Okay, nurse.
Besides these measures, you can also apply a cold compress to the affected area, which will give you great relief from both pain and itchiness.
Oh, I see.
Serena, it is important not to scratch the affected area. Avoid scratching. Instead, the application of cream and cold compress can subside your discomfort.
All right. I understand that.
That's perfect. Do you have any other concerns?
No, nurse. It's all right.
In case, If the symptoms do not subside even after a week, seek medical help.
Sure, I will.
Thank you for listening to me. Feel free for further queries. I wish you a speedy recovery.
Thank you. That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.